Smoke weed every day. Ooh, 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 ooh. Smoke weed every day. Ooh, 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 ooh. Okay. Oh, I will stop saying. Uh, I know, it's a TED Talk, not a singing contest. But do you know what? This song is actually related to today's topic. Weed, aka cannabis, aka marijuana, is a kind of special plant that can cause various effects on your brain and you may addict to it. You may heard of this through memes, rap songs, and some animation like South Park. But do you really understand what it is? But before I talk about cannabis, there's one thing I need to remind you. Any usage of cannabis is illegal in Hong Kong, including entertainment and medical use. But what I'm going to talk about is the medical use of cannabis in other countries and what we should apply and whether we should apply similar approach in Hong Kong. So, I know some of you may not know how cannabis works. Don't worry, I will explain to you. Cannabis has two active ingredients. The one is THC, tetrahydrocannabinoids, and the other one is CBD, cannabidiol. THC responsible for cannabis psychoactive effects, and CBD responsible for cannabis non-psychoactive effects. So, it works by binding to specific receptor, CB1 and CB2 in our brain. Yes, we have receptors specified for cannabinoids. You can even say that part of our bodies is born for smoking weed. Just kidding. Actually, you can also find similar receptors in some other animals. After THC and CBD binds to the receptors, THC slows down signaling. These affect how you move and sense things. For example, THC may slow down a signal that inhibits smell, and the sense of smelling will be more intense. But that's all short-term effects. Will people have long-term effects physically or psychologically? Well, we can take a look at some example. If you watch sports like NBA or UFC, you may know that many professional athletes have a habit of smoking weed. For example, NBA superstar Kevin Durant and UFC fighter Nate Diaz love smoking weed, but still they can become top athletes. We can see many other similar cases in other sports. So we can see that weed won't cause huge damage to human bodies. And at some points, cannabis can even be a kind of medicine that help relieve pain and some side effects of cancer treatment. In USA, some states legalize the medical use of cannabis. The hospital and clinics will prescribe special cannabis to some patient who has doctor permission. This kind of cannabis has lower proportion of THC and higher proportion of CBD. CBD can make people relax, and THC can bind a signal of pain. But can we say cannabis don't have any side effects? Of course not. The learning ability will be affected if you have a habit of smoking weed under 25 years old. Your ability of short-term memory will be weakened. Imagine you are a secondary school student preparing for DSE, and you forgot to study a very important part 1 or 2 days before the exam. You studied hard in these few days, but still you forgot everything in the real exam just because you smoked weed. That will be the worst nightmare for every student. Now you know about that, but not every teenagers know. They may not even care about it before it really happens to them. If cannabis is totally legalized, it's very hard to restrict the use of cannabis for people who are under 25 years old. So what I'm going to say is that in Hong Kong, the legalization of cannabis for entertainment may be too early and too dangerous. But we should consider the medical use of cannabis. If we control the use of cannabis well, we can help patients who suffer in depression and cancers. So many medicines also come from drugs, or the medicine itself could be seen as a kind of drug. For example, cough drops and ketamine. Some of you may not know, both ketamine and morphine are kinds of pain medication. But ketamine is mainly used in children and pets, and morphine is mainly used in adults. Both of these could be drugs if you don't use it properly. But today, morphine still becomes one of the most popular pain medication in all hospitals. I think cannabis also have the same potential. Do you share the same view?